Hello everybody, this is Hannah and Jess from Oscha Slings, and we're here to do
Hi.
a Q&A all about breastfeeding. So breastfeeding in a sling. We will also cover a little bit of bottle feeding as well, and some of the techniques and tips that you can use for feeding, just nursing in your sling in general. So we welcome you to ask any questions at all that you have, and I will ask those to Jess as we go along, and we also have some questions that have been sent in to us already, which we'll cover. So we're going to start with a wrap, and then we'll look at ring sling, and we'll look at a carrier as well. And feel free to ask any questions at all that you have about breastfeeding in a sling, bottle feeding in a sling, and also using the wraps and the ring slings. If you have any questions, we're here to help you. So I'll just kick off by giving you a little bit of an intro about who we are, and then I'll hand over to Jess to start us off. So I'm Hannah from Oscha Slings, and I work with our content and our broadcasting, and hopefully many of you will recognise me from our demonstration videos on our YouTube as well. And this is Jess Hippie. She is a Sling Consultant. I'm also a Sling Consultant, but Jess is a Sling Consultant at Close and Cam in Aberdeen in Scotland, and she has many years of experience in using slings, but also with her two boys. So I'm going to pass over to Jess, and first of all ask Jess about the benefits of using a sling while you're breastfeeding.
Thanks, Hannah. Yeah, there are lots of benefits to using a sling, and I think the first one for me was confidence. So when my baby was just a couple of days old, they got really upset and we were out and about, and I was like, oh no, I can't find anywhere. And I actually just gave it a go, and it was brilliant. And having the confidence to know that I could go on walks and I could go out and about and I'd still have somewhere that I'd be able to feed them and some way of doing it was fantastic. So that's a huge benefit for me, and just giving me the confidence to do the things that I wanted to do and know that it would be okay without having to like plan ahead to find locations and things. Another really good benefit is responding to feeding cues. So the earliest feeding cues, like they don't just cry when they're hungry, they have little feeding cues that build up to that, and they're really subtle. So it can be that they start to jiffle, they start to like move their head side to side and like root. And if they're right here, you can see that so easily. And so it actually really helped me again with my confidence, because I could see them and I could meet their need and feed them before they got upset. Whereas if they were further away from me, sometimes I wouldn't have noticed that. And then I was left with an upset baby that I had to calm first and then do it. So it really helped with that. It helps with skin to skin. So skin to skin is incredible benefits for the baby, for the parent, and also for feeding. So it really helps with milk production and milk flow and creating a great bond with your baby. But skin to skin is really difficult to do because it means you have to be undressed. Whereas if you're in a wrap, you can just have like a bra underneath, and your baby can be in like no clothing, just in a nappy, and you can do skin to skin and you can still be covered. So that was really helpful at home, especially when like we got a delivery and I could get up and answer the door and not be obviously doing skin to skin. So that was fantastic. And I guess the oxytocin production overall really helps just with the bonding and things. And my last one, I'm sure you'll ask me more questions as we go along, but my last one for now would be the reflux. So both of my boys suffered with it like a lot. And so we had to keep them upright after their feed. And that's really tricky. You already have the feeding time. And then I had this amount of time that I had to keep them upright after. And obviously in a carrier, it's the perfect position. So it helped so much with that as well.
I think those benefits are really interesting, and actually the first one that you mentioned there about not maybe necessarily being able to find somewhere to feed, and I
I
suppose
can't
at the
hear you at
moment
all,
that
Hannah. Sorry, your sound seems to have
oh
gone.
oh, you can't hear me?
No, I can't hear
Okay,
you at all. Sorry.
give me 1 second and I'll see if I can sort this, because if you can't hear me then maybe other people can't hear me either. um
I wonder if anyone else can hear you, or if it's just me.
Marta, can you hear me okay? Okay, I'm just going to come out of this and come back in.
I think Hannah's going to leave the broadcast and try and rejoin to see if we can hear her. Otherwise, I guess I'll just have to ad-lib on feeding.
Hello? Can you hear me?
Hey, there we go. Yeah, I can hear you now. Perfect.
Sorry
Not
about
at
that.
all. That's fine.
Thank you for all bearing with us there quickly. So what I was saying was the first benefit that you talked about there was really interesting because, you know, in the times that we're living in just now, hygiene is just so important. And I can imagine if you are going out and about somewhere, you're on a walk or something, and you do get caught out and you do need to feed your baby, and you can't find somewhere, maybe you're in the mall or the supermarket, and you need to feed your little one. At least some of the tips and tricks that we'll show you today and the methods of showing you today will allow you to be able to feed your baby kind of on the go, where you don't have to put them down onto a changing mat that you don't know who's been there before, and you know, just kind of keeping everything nice and clean, which we're all really obsessed about at the moment in particular.
Yeah.
Okay, so Jess, would you give us a demonstration in the wrap that you have a front wrap cross carry on at the moment in our woven wrap? Could you give us a demonstration on how to feed in the woven wrap?
Yeah, sure. So there's two options. If you're going to feed like in an upright position like this, you would literally loosen it and then lower your baby. I struggled to do that actually. Some people find it really easy and some people don't. So give it a try. And if you find it easy, then that is one of the easiest ways, because you would just loosen it and introduce some slack here. And then you can, I'm not going to do the whole thing because I'm going to show you the cradle one just now. But if you would loosen it and you'd just lower them down and then you'd feed up, right? And that is very simple, and if you can do it, it's fantastic. One thing I would say is if you can get practice doing that while you're not in a wrap, and see if you're, because it's something that you and your baby need to master. There's not just you in a feeding relationship. And so if you can practice doing that with your baby not in a wrap, then if they can manage upright feeding, then you'd be able to hopefully do it in a wrap. Most people will have a slightly reclined, I think I said cradle, I don't mean cradle, I mean like a slightly reclined position for feeding. So I'll show you that now. So I've undone the knot at the back, and I'm just going to tie a half knot here. And what you need to remember is as soon as you've started undoing your carrier, it is no longer hands-free, and it's not adhering to any of the safety guidelines that we say about being tight, because, you know, we've just loosened it. So you need to hold your baby, and the carrier or the wrap acts as an amazing third hand, which we all want. And so it gives you one hand free, but make sure you're always supporting your baby the whole time. So I've loosened it and I've tied a half knot here. And for this demo, I'm going to feed from my left side. And so what I'm going to do is I'm going to take my baby's head across to the left, and I'm going to take their feet across to the right. So I do that by just putting my hands under and grabbing their feet, and the same at their torso. And I'm just going to slowly move them across. So it should be a nice gentle movement for them. And as I do it, I'm making sure that here it supports at both knee pits. And that does involve tucking a little bit of fabric up between yourselves. And we always want to make sure that there's no fabric at the back of your baby's head, because they need to be free to latch on and off, which means that the whole time they need to be either supported with a hand or with your arm, because we definitely don't want anything here, but that also means that there's nothing supporting them there, so we need to do that. You can also, this part here, move that out of the way slightly, just drop it off your shoulder. And I'm wearing two tops today. I'll do it this side because it's probably easier to see. I wear a vest top that's nice and tucked in, so it means that I can pull up this black top as high as I like, and I'm still decent at the sides, which was really helpful to me. That was my go-to of having one up, one down. And so it meant that I could then just pull this top up here, help my baby to latch on. And another incredible benefit of this is that you now have a hand free to help them latch on. So you've got this hand, which is helping support their weight in the back of the head, and you've got a hand here to help your baby latch on. So make sure that there's one hand either side of your breast, and then help your baby latch on. And then that's you feeding.
Jess, we have a question from somebody through Instagram who's asking, how can you safely give newborn neck support while nursing? She said she could never figure it out.
Yeah, I think that is a really valid question. And I think the answer is that we don't want to give neck support with the fabric at all, because if you do, then they can't latch on and off. And so that's why we need to do it with the crook of your arm or your hand. Also, if you can't figure it out, that's totally fine. And newborns are like so delicate, and you're new to feeding and they're new to feeding, and it might be that they're still figuring it out too. So if it's something that's not working for you, don't worry about it. I would just give it a couple of weeks of feeding without the wrap and then try again, because they'll grow in it. Like, it's a skill that you both need to learn and you'll both grow in it. So it's much better that you're enjoying feeding and that you have a great relationship with your baby rather than worrying about something that you can't do. So I just give it a break and then try again in a couple of weeks.
Yeah, that sounds great. We also have another question about feeding in the front wrap cross carry, which I think you did just before, and that was about having small boobs and how to do it safely, how to feed safely in a front wrap cross carry.
So, however you're feeding, you should be mimicking what you do without a wrap. So it shouldn't be adding anything different. It shouldn't be changing the position differently. It should just be supporting what you normally do. So I'd get them to have a look at how they normally feed, where the baby's head is. Perhaps they need to move their baby like more towards the center to get on. Like, it would just depend on the position. Perhaps they need to move the baby lower or higher, depending on the shape of their breast. So I'd get them to have a good look, and even perhaps if they have a partner who'd be willing to take a picture of them feeding without a wrap, so that they can get an idea of what sort of height their baby's at, what sort of position that they're at, and then they'll know to mimic that.
That sounds good. So is it safe to feed in the sling?
Yeah, it is safe to feed in the sling. And I would also say that there are added things that you want to look out for to make it safe. So when you're feeding in a sling, you are adding extra things that we need to be careful of. So we really need to be careful of their airway. We know that the upright position is the easiest position for them to breathe in. And currently they're in a slightly reclined position. So that means we need to be really attentive to their airways. We need to make sure that their chin isn't slumping on their chest at all. So their spine's like in a nice straight line here. You want to always make sure that, I'll turn this way so you can see, that they're visible. So I can see the baby's nose and mouth. It's not covered in fabric in any way at all. And I know some people like to use covers and things. Baby's head should always be exposed, and you should always be able to see their nose and mouth. If you do want to use some sort of cover, you can use the tails of the wrap. And I'm just going to take it right round so that we're not going over the baby's face. And you can cover yourself higher up here, but you would still always need to make sure that their nose and mouth are clear here. You also want to make sure that their hands are either side of your breast. That's really good for feeding position for them. And you need to be careful of the tails, because when you want to do wraps, you've then got long tails in front of you. So just make sure you're not tripping up at all. And as soon as they finish feeding, you want to return them to the upright position, because that is always the safest position. So you want to return them to that position straight away. The only other safety thing I think we've said is not covering the back of their head, so that they can latch on and off freely, and make sure you're supporting it with the crook of your arm or your hand.
So would you show us how to move the baby back into an upright position safely after feeding just now?
Yeah, so once they've finished feeding, you would help them unlatch if they haven't already. Sometimes they fall asleep while still latched, which is extremely cute. And then you want to reverse it. So their legs want to come back to the center and their head wants to come back to the center. So again, I would do it very incrementally, and I'm just gently returning them to the upright position, supporting them the whole time, because the wrap isn't doing the work at the moment.
May I just ask you, Jess, if they do fall asleep, would you still encourage moving them back up into that upright position even while they're sleeping?
Yeah, I would always. I think the increased safety risks and things associated with having them reclined means that you need to be like fully attentive to them, checking that they're latching on and off the entire time. And it's always much safer upright. So even if they're sleeping, I think just a gentle move Also, it really helps with their digestion being upright. So they might look cozy and you might be nervous about moving them, but actually they'll feel more comfortable in this position. And it really helps you for like winding them. You can start, even if they are asleep, start gently patting, walking them around and winding them as they go. So it'll be much comfortable for them in the long run too.
That sounds really good. That's an extra little benefit, I suppose, of being able to carry
Yeah,
in the sling. You can kind of wind them, get kind of on you as you go, I guess. So you don't need to have
yeah,
a big movement to wind them.
yeah, exactly.
Mm-hmm. Great. So perhaps you can show us the ring sling next, Jess, and we'll see how we can breastfeed in the ring sling. And if anyone has any questions at all, please do let us know. I've got an eye on the questions here, so we'd love to hear from you if you've got any questions or thoughts at all about breastfeeding in a sling, or perhaps you've got your own tips that you'd like to share with other mothers watching as well. So Jess is using, I think it's a gathered ring sling. Is that right, Jess?
Yeah, yeah,
Yeah.
I really like it gathered.
And she has already threaded the rings, so she's able just to put the sling on and get the pouch in the right position, and then away we go.
Yeah,
We have
I've cheated.
That was good. Yeah, we also have tutorials on our YouTube channel. So we've got really thorough tutorials on breastfeeding in the wrap, the ring sling, our bairn, and I believe our Keris as well, our Baydai carrier, the Keris. So you can also find instructional videos on YouTube for how to use the slings as well, just in general, aside from breastfeeding.
Yeah, I cheated. I did size this one before because do you know what? That's the benefit of ring slings. I love that
Yeah.
you can do it. I love how quick they are once you've used them and set them up. And yeah, so I did do that. There we go.
That's
So
great.
this little one is seated slightly off center, so he'd probably be about 4 or 5 months old. You can carry them off center as soon as their hip width is wide enough, so you'd know that from when you're carrying them in your arms anyway. And then we'll feed on the other side just now, just to give you both sides, but to be honest, it's very much the same. So I'm going to put my hand under the tails and I'm going to scoop their legs. So I'm just leaning forward a bit to give their legs some room. You can loosen the rings if you need to for this. And again, we're making sure that they're supported in the knee pits on both sides. So pulling up some fabric between myself and the baby. This baby's head's actually in a great position for bottle feeding, so I'll just mention that just now anyway. But if for bottle feeding, it works just as well. So you'd now have the bottle here and you'd be able to feed them, and they're looking slightly more up to the ceiling. For breastfeeding, their head would naturally, you wouldn't turn it, be turned in towards your chest, and then you can then latch on again. So that works really well as well. And also the ring sling tail again can be used as a cover. So if you want to do that, take it up out the way of your baby's face and you can pop it gently down there just to cover it if you wanted to cover any tissue yourself. Again, we're supporting our baby's arm. We're making sure that there's no fabric at the back of their head.
That sounds great. And I suppose, as you mentioned there with the bottle feeding, when you were in the cradle or the slightly cradle position with the wrap, you could have bottle fed then as well if you wanted to.
Yeah, you could. And I actually found it really helpful because one of my babies, they refused to feed and ended up needing a bottle. And he kept pushing his head back, and that was really difficult to do two-handed. So I often used to use a carrier for that because this one hand helped with his weight, and then I could help support his head here and still have one for the bottle. So it worked really well.
Can you also slide baby down in an upright position in a ring sling, or is it a bit more awkward to do that?
Yeah, no, you can. So I'll just return them to the center. And depending on what side, we'll just go for this side again because baby's here. So I'm going to hold their weight because I'm going to loosen the rings. And you would just help lower them down there and again support the back of their head, and you could just latch on there.
That's
And
great.
then again, you want to return to the original height even when you're feeding upright and you've just lowered and you haven't reclined, you still want to return to the original height, because it's better for them to be in a place where there's not lots of soft tissue. It's just easier to make sure that their airways are nice and clear, and it's easier for you to monitor them as well.
That makes a lot of sense. Great. So are you ready to try to demo with the Bairn carrier now?
Yeah, sure. Yeah, that sounds
Right.
good.
So we're going to show you the Bairn carrier now, which is our full buckle carrier. So the videos that we've shown you here today, you know, could be used for any brand of sling, but obviously we're showing you with our lovely Oshas in all of our different patterns and colours. And we are, the Bairn carrier is our newest sling that we have launched. So it is a full buckle. It's really simple and lightweight, really easy to use from newborn all the way up until about 2 years old. So it is made from our lovely woven fabric, and we love matching the webbing as well to the colours. So it's really nice and stylish as well. So Jess is just clipping that in. Again, we've got tutorials for the Bairn on our YouTube channel, and we also have plenty of images on our website. So if you are interested in any of our carriers that we're showing you today, then you can check them out there. So how would you breastfeed in a full buckle carrier, Jess?
So upright. So again, this is one where you would want to make sure that you and your baby have practiced feeding upright and that you are familiar with that position before you try it in the carrier. And then again, it would be the same, like loosen and lower. So the buckles, I've got it cross-strapped just now. It can also be worn rucksack strapped. So you would loosen the webbing here. And again, as soon as you loosen the carrier, you need to be supporting your baby. And just pull the straps forward, and that will help bring some slack into it. And that should be enough to lower your baby down. If it's not, you can also loosen the waistband a bit here and move the waistband down too and feed them there. And then when you're done, that's actually a little too loose. I want it to offer some support. So we want it to be a third hand. So if you do over loosen it, just retighten it a little bit. And then when they've finished feeding, again, we want to return them to the upright position. So you would lift them up to the position that you want them to be in. If you've lowered the waistband, you would move that up first. That really helps get the positioning right and helps get the straps all into place easier than if you did the straps first. So I would put the waistband up first, then help encourage them back into their deep squat. And then I would tighten the straps.
And when you are feeding in the sling, in any of the slings that you've shown us today, can you walk around, or do you need to be stationary? Can you stand up? Do you need to sit down? What would you recommend in terms of safety and comfort for you and your little one?
So I think as soon as I hear that question, I'm always quite sensitive to mums, I guess, and what they're going through. So my first thing would be like, do you need to be moving around, and do you maybe just need 5 minutes to get someone to give you a hand so that you can sit down and feed your baby? Because I think a lot of the times our world that we're in expects us to just get straight back into it, and actually we just need a little bit of a break. So I would first ask that, but then I also have the reality of having had a newborn and a toddler where sitting down wasn't always an option. So yeah, it can be done stood up, it can be done safely. The safety checks are what is important. So you need to be able to monitor your baby and see that they're breathing, see that their airways are clear and they're not overheating, see that they can latch on and off and they're well supported. And if you're doing that, then yes, you can do it stood up. All of the demos that I've done here have been stood up. So you absolutely can. If you're walking, again, you've got an extra trip hazard. Your hands wouldn't be as free because you've got one supporting your baby, so you'd need to watch out for falls and things. But again, I know that sometimes it has been necessary to people to do that. So just bear in mind all the safety precautions, make sure you're aware of what's in front of you. Yeah, and just really be attentive to your little one.
That sounds great. Thank you, Jess. We have a question here as well around, do I still need a feeding pillow to feed?
So no, and that was like a game changer for me, especially with my first, who I seem to only be able to feed on the feeding pillow in the right chair. And so to figuring out that at a carrier I could get them at the exact height that I wanted without needing to take my massive feeding pillow on all of the journeys I went on was brilliant. And so yeah, it really helps with that.
That sounds really good. And what about clothing tips? What would you say around clothing? Because I suppose that's something that breastfeeding mothers are always thinking about.
Yeah, I think it's the only time in my life that I've ever tried to get dressed around how can I easily access my chest. You can get breastfeeding clothing, which has hidden like slits or compartments or flaps so that you can easily access your chest. You can get nursing bras that have clips here so that the panels come down. And you can also do what I've done today, where you have like a vest top here, so I can lift this one up and still um, have this one here and access my breast without being cold is one of the reasons. Some people think it's like fear of being exposed, but I'm like, in Scotland, it's often just fear of being freezing. So
Yeah,
it still means you can feed and you only have to access, your nipple area and still have the rest of you covered.
that sounds great. So I think we have covered all the questions that have come in so far. Do you have anything else to add, Jess?
I think the only little tip that I would add would be tuck in a muslin in your carrier. Um, so it's really easy to just have one tucked away so that if you are feeding, you've got something to wipe them on, or if they have a little bit of spit up, you've got something right there, and you can just discreetly do that. I found that really helpful. Um, and I don't think anything else. I think that's
That
probably all of my tips. Yeah.
Great. Well, we will keep an eye on the thread here. If anybody does have any questions in the future and you're watching this video back at a later date, please do just pop any questions or comments down below and we will get back to you as soon as we can. So thank you very much for joining us today, Jess, and thank you to everybody who has watched the video this far.
Thanks for having me.
Great. Okay. Bye for now.
Bye.